Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christianson. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. Christianson here with you, and let's take a deep dive in iodine in medications. So, medications with iodine can be one of the most common triggers for thyroid disease. In one study, 11% of patients that were consulted for thyroid disease had been exposed to excessive iodine from medications. Many medicines can be hidden sources of iodine. I'll talk through several that can have that. Now, of course, no doctor prescribes medications unless they have a reason for that. There's always the assumption that the benefit will outweigh the detriments, the risks, or the side effects. So if you do have thyroid disease, and if you find that you've been prescribed one of these medications, please do have a good conversation with your prescribing doctor. I don't want you to just stop it and call it good because it might have been helpful. It might have been important. And in almost all cases, there are some iodine-free options. So one of the biggest areas in which this comes up is iodine as a contrast agent for medical imaging studies, such as CT scans or MRIs. This has fallen from favor, and iodine is less commonly used. There are forms of gadolinium which has largely replaced it. Now, earlier versions of gadolinium were associated with some versions of complications. Negative reactions are thankfully much lower in modern versions of gadolinium. And a lot of the concerns are based more so on older types. So allergic reactions can occur. They're rather rare. They're about 0.04 to 0.3% of the time. Other reactions can be significant, especially in those with impaired kidney function. So gadolinium does not harm the kidneys per se, but those with low kidney function do not clear gadolinium at as typical of a rate. But most with thyroid disease, it is argued to be a safer agent for contrast. So if you are to be getting a contrast study, a CT or MRI, please do clarify that you have thyroid disease and you wish to use a non-iodized contrast agent if possible. The iodine in contrast agents is high compared to the amounts in other sources. However, it often is cleared. It's a type that is less apt to bioaccumulate. More of it is bound, and much of it does leave the body. So even though the actual microgram content is higher, this form is less correlated with complications than iodine from other sources. I'll talk about several medications. Boy, top of the list is amiodarone. This is a medication that regulates cardiac rhythm. And this is one that's given for heart rates that cannot stay stable. Now, I mentioned before about how medications are never given lightly. That's doubly, triply, quadruply so for amiodarone. The side effect lists are, the plausible common side effect lists are a yard long, and they can be delayed. They can come on many months after exposure. There's a version called dronedarone, which is quite similar, but it does not contain iodine, and it has a much lower risk of side effects. So we do know that much of the harm from amiodarone is a function of the high iodine content. And I bring this up to say that doctors do not prescribe it lightly. So there are times in which it may be the best call. So as bad of a thing as it is, the situation may warrant it. The cardiac situation may be so desperate that it really is the best thing to do, even though it can have some harm onto itself. But it can contain 250 milligrams or more of iodine per tablet. So this can bioaccumulate terribly. And this is where serum iodine tests become useful to gauge the long-term bioaccumulation. Serum iodine tests don't show the nutritional status for iodine, and they can be misleading that way. But they do reflect toxic exposures, amounts that are so high that iodide converts to iodine outside the thyroid. And that's where we start seeing just organ failure across the board from it. So that's amiodarone. We also think about benzoiodorone, calcium iodide, diiodohydroxyquin, argen hydriodic acid syrup, iodinated glycerol, idox, I've not even seen that one before, isopropamide iodide, potassium iodide, mudraine, Lugol solution, niacinamide hydroiodide, Ponaris nasal emollient, supersaturated potassium iodide. Those are some medications that are common ones. Nasal emollient, there's some stories of those to where that was the sole factor that gave them lasting thyroid disease. A lot of it is absorbed across that. We'll see injectable solutions that have that. Many topical antiseptics are iodine-based. Iodine tinctures, iodoform gauze, povidone iodine, also called betadine. These are things that do cross the skin and it does bioaccumulate. So by and large, always think about safer medications and get in the habit of asking both your doctor and your pharmacist. I have seen patients tell me stories to where their doctor wasn't aware about a compound being iodine-based, but their pharmacist was. And the action steps were a phone call between the pharmacist and the doctor and a conversation about possible alternatives, and alternatives can generally be found. So yeah, please do think about your medications and iodine. Remind your doctors about you having thyroid disease. They may not be your thyroid prescriber. That may not be top of mind for them. But in most cases, that can be circumvented. So that's it. Dr. C with you. Take great care, and we'll talk again really soon. Bye-bye. Hey, Dr. Christianson here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christianson on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.